Okay, so this is the lumbar active tests. And first I'm going to have them do it in standing because usually standing is the position where they have the least amount of symptoms because sitting there's more of a compressive load in the spine. But you also have to consider the patient's symptoms, so I could ask him, do you have any symptoms in standing?
No.
Okay, so I am going to do it here, but if he had symptoms in standing and not in seated, that's also possible, so just go by where they don't have symptoms first. So the first thing I ask you to do is just kind of bend forward, try really hard not to move your hips, but just try to bend forward like this. And I'm going to be watching in the back of his back to see if you notice anything abnormal or just kind of like appreciate the movement. Alright, go ahead and do it again for me. Okay, he's moving a little bit in his hips, so maybe I could even stabilize and tell him to do it one more time. Okay, good. Come back up. And I'm going to ask you to lean backwards. Alright, good. And now we'll do a couple motion and flexion. And so what I want you to do is all in one...
Rotation and side bending.
What?
Do rotation and side bending too.
Okay, before we do that I guess I'll do rotation and side bending. So rotate to your left please, like just using your trunk. Okay, good. Try to move your hips to your right.
And while doing all of these, you have to ask if there's any reproduction of the symptoms, if there's any pain, if there is, if it's the same as the symptoms that he was getting before.
Yeah. Are you in pain? Oh. Okay, can you bend like this to your side? And to your left? To your right, I mean. Okay, good. And now we'll do a couple motion and flexion. So what I want you to do in one motion, I want you to flex, bend to your side, and rotate all in the same direction. So it's going to look like this. Basically try to touch your elbow to your opposite toe. Okay. Okay, one more time. Alright, good. Now the opposite direction, same thing. Okay, good. And now we'll do uncoupled motion and flexion. And so what that one's going to look like, same thing except for you're going to go to the same side. So I want you to, it seems like that, but all in one motion. Okay? Okay, and then do the opposite side. Okay.
And for this one, if the patient doesn't understand, you can also use cues to have your point finger and point over here and stuff like that.
Okay. Now I want you to do this. This is going to be, we're going to do extension, couple motion. And so I want you to lean back, bend to one side, and look to the other side, like rotate your body. So all in one motion though, so it's going to look like this.
Okay.
Okay. Okay, good. Now to the other side. Okay. And now we're going to do uncoupled motion for extension. So I'm just going to go back and do the same side.
Okay.
Okay, good. Any reproduction of symptoms or any pain with any of those? Nope. Okay. Now we're going to do it in sitting. So